Welcome to Education Open Source. This is a video on atherosclerosis. Please put your comments in the box below, or share this video using share button. Atherosclerosis is a condition in which an artery wall thickens as the result of a buildup of fatty materials such as cholesterol. Atheroma is a focal disease of the intima of large and medium-sized arteries. It is a chronic inflammatory response in the walls of arteries, due to the accumulation of macrophage white blood cell. It is promoted by low-density lipoproteins without adequate removal of fats and cholesterol from the macrophages by functional high-density lipoproteins. Atherosclerosis is mainly due to hypercholesterolemia. Risk factors for atherosclerosis are high blood pressure, high cholesterol, tobacco smoke, diabetes, obesity and physical inactivity. Steps involved in development of atherosclerotic plaques. If there is any injury or damage to endothelium of artery, this leads to expression of adhesion molecules. This encourages migration of monocytes from the lumen into the intima. Substances traveling in the blood like low-density lipoproteins, fats and cellular waste materials accumulate at the damaged site. Endothelial cells and monocytes generate free radicals that oxidize LDL, resulting in lipid peroxidation. The oxidized macrophages are taken up by macrophages via scavenger receptors. Because of foamy histological appearance, these macrophages are called foam cells. These foam calls and T lymphocytes at the damaged artery wall form fatty streaks. Activated platelets, macrophages and endothelial cells release cytokinins and growth factors, causing proliferation of smooth muscle and deposition of connective tissue components. This inflammatory fibroproliferative response leads to a dense fibrous cap overlaying a lipid-rich core, the whole structure comprising of atheromatous plaque. Sometimes the plaque can rupture and flow into the bloodstream and cause thrombosis. Lipid-lowering drugs or hypolipidemic drugs can be classified as HMG-CoA or reductase inhibitors like statins, bile acid sequesterants or resins like cholestyramine drugs that activates lipoprotein lipase enzyme or fibric acid derivatives like clofibrate. The rate-limiting enzyme in the cholesterol synthesis is 3-hydroxy-3-methylglutaryl coenzyme A, HMG-CoA, reductase. HMG-CoA reductase catalyzes the conversion of HMG-CoA to mevalonic acid. HMG-CoA reductase inhibitors inhibit the enzyme HMG-CoA reductase enzyme, and thus inhibit the synthesis of cholesterol. Decreased hepatic cholesterol synthesis upregulates LDL receptor synthesis, increasing LDL-C clearance from plasma into liver cells. The main biochemical importance of statins is to reduce plasma. Simvastatin, lovastatin and pravastatin have a shorter duration of action. Atorvastatin and rosuvastatin are long-lasting inhibitors of HMG-CoA reductase. The activity of HMG-CoA reductase is maximum during midnights and hence, all statins which have shorter duration of action are administered at night times. They are given orally. Except rosuvastatin, all other statins are metabolized by CYP3A4 enzyme. Adverse drug reactions are: all statins are well tolerated. Mild unwanted effects include gastrointestinal disturbances, headache, bowel upset, rashes and sleep disturbances. Raise in serum transaminase enzyme can be seen, but liver damage is rare. Serious adverse effects include muscle tenderness and myopathy. Drug interactions are: risk of myopathy increases when statins are given along with nicotinic acid or gemfibrozil or CYP3A4 inhibitors like ketoconazole, erythromycin, cyclosporine, HIV protease inhibitor. Fenofibrate interferes the least with statin uptake metabolism and should be preferred for combining with them. Clinical uses are Secondary prevention of myocardial infarction and stroke. Primary prevention of arterial disease in patients who are at high risk because of elevated serum cholesterol concentration. Atorvastatin lowers serum cholesterol in patients with homozygous familial hypercholesterolemia. In severe drug-resistant dyslipidemia, ezetimibe is combined with statin treatment. Now let us discuss mechanism of action of fibrates. Their mechanism of action is complex. Fibrates are the agonists for a subset of lipid-controlled gene regulatory elements, PRA-alpha, which are members of superfamily of nuclear receptors. Their main effect is to increase transcription of genes for lipoprotein lipase. They increase the hepatic LDL-C uptake. Adverse effects are myositis is unusual but severe side effect, with hemoglobinuria and acute renal failure. It is mainly due to reduced protein binding and impaired drug elimination. Common adverse reactions include epigastric distress, diarrhea, skin rashes, body ache, impotence, headache, blurred vision. They are contraindicated during pregnancy and also in alcoholic individuals. Bile acids are biosynthesized from cholesterol. The disruption of bile acid reabsorption will increase the cholesterol metabolism, particularly LDL-C metabolism. Bile acid sequestrants are polymeric compounds which serve as ion exchange resins. Bile acid sequestrants exchange anions such as chloride ions for bile acids. By doing so, they bind bile acids and sequester them from enterohepatic circulation. Since bile acid sequestrants are large polymeric structures, they are not well absorbed from the gut into the bloodstream. Thus, bile acid sequestrants, along with any bile acids bound to the drug, are excreted via the feces after passage through the gastrointestinal tract. Their adverse reactions are: they are not absorbed systemically, so they show very few adverse effects. Common side effects include gastrointestinal symptoms, especially diarrhea. Bile acid resins decrease the absorption of fat-soluble vitamins and of drugs such as clothiazide, digoxin and warfarin. So these drugs should be taken at least 1 hour before or 4 to 6 hours after taking bile acid resins. Nicotinic acid derivatives are nicotinic acid or niacin in higher doses reduces plasma lipids. Mechanism of action: nicotinamide inhibits hepatic triglycerides production and VLDL secretion with reduction in triglyceride and LDL-C, and increase HDL-C. The mechanism is poorly understood. It is believed to be initiated by an effect on lipolysis via G protein-coupled orphan receptor HM74A present in adipose tissue. Adverse effects on nicotinic acid is a cutaneous vasodilator. Marked flushing, heat and itching are seen at every dose. Dyspepsia, vomiting, and diarrhea occur when full doses are given. Hyperpigmentation of skin, liver dysfunction and jaundice may occur. It is contraindicated in pregnancy. Drug interactions: postural hypotension may occur in patients on antihypertensives. Risk of myopathy due to statins is increased. Various fish oil derivatives are also used in treatment of atherosclerosis. Polyunsaturated fatty acids present in fish oils prevent the cholesterol synthesis. Thank you very much, Namishka, for donating this video to Education Open Source.